cervical cancer starts in the lower part of the uterus, and oftentimes a woman may not even know she has it because there aren't any symptoms in the early stages. While cervical cancer is the third most common type of cancer worldwide, it is also considered one of the most highly preventable.
According to the Guam Cancer Registry, between 2003 and 2007, 31 women on Guam were diagnosed with cervical cancer, and 15 women have died. It is the sixth common cancer diagnosed in Guam.
Vanna Manel is the program coordinator for the Guam Breast and Cervical Cancer Prevention Program.
The most common cause of cervical cancer is the infection of the human papilloma virus, which is sexually transmitted. So there are certain types of HPV that can cause cervical cancer. These types are HPV 16 and 18.
Cervical cancer starts in the cells on the surface of the cervix. The cells are known as squamous and columnar. Most cervical cancers are from squamous cells. According to medical websites, cervical cancer usually develops very slowly. Experts say a precancerous condition known as dysplasia can be detected by a pap smear, and it's 100% treatable. Without regular pap smears, a woman might not know that she has had dysplasia, and undetected precancerous changes can develop into cervical cancer and spread to the bladder, intestines, lungs, and liver. Risk factors of cervical cancer include having sex at an early age, multiple sexual partners, and a weakened immune system. Oftentimes, those with early cervical cancer won't know it because there aren't any symptoms. But some people may experience abnormal vaginal bleeding between periods, continuous vaginal discharge, and heavier periods. For those who have advanced cervical cancer, symptoms will include back pain, bone fractures, fatigue, heavy bleeding, leg and pelvic pain, loss of appetite, and weight loss. Early cervical cancer can be cured by removing or destroying the precancerous or cancerous tissue. It's for this reason that officials on Guam are urging parents to get their girls vaccinated to prevent them from getting HPV and spreading awareness for women to get a pap smear annually.
We are encouraging, children starting at 9 to 26 to get their HPV, because this vaccine can prevent cervical cancer. And those older women, 21 and over, we're asking them to have their regular mammogram, regular pap tests, and this is done, annually, depending upon the pap test that they're having. For conventional pap tests, we're recommending it to have it every year, and if they're using the liquid base, then it's every 2 years.
American Cancer Society Community Manager for Health Initiatives, Marisha Artero, says data from the Guam Cancer Registry has shown that about 315 people every year are diagnosed with cancer on Guam. With its prevalence in the community, Artero says it's critical that everyone takes active steps toward prevention.
As everyone is thinking and talking about their New Year's resolutions, to put their health first. So there's a number of things that people can be doing. First and foremost, making those visits to see the doctor, making sure that you are getting your cervical cancer screening, asking about colon cancer screening, and just being mindful of the things that we could be doing for diet and exercise to be cancer-free. So focused on eating well, and of course the exercise that we all need to maintain that healthy lifestyle.
HealthCheck is presented by